Thank you everyone for joining today's educational webinar with Global Partnership for Telehealth titled Toddler Tracks: Pathways to Tackling Autism with Boyd Mark. Next month, on April 29th, Dr. Fine will be presenting Changing the Way Hematology is Practiced with Telemedicine. We welcome you all to join us for Dr. Fine's presentation on April 29th at 12:15 p.m. Eastern Standard Time. Before we get started, I'd like to share a little information with you about GPT. Global Partnership for Telehealth is a nonprofit telehealth organization with a focus on consultative services, turnkey hardware solutions, and our easy-to-use telehealth platform, Pathways. Our organization was founded in 2004 to build a telehealth network in the state of Georgia that quickly evolved into our current mission to leverage telehealth technology for the benefit of all. Our vision is to enable healthcare everywhere with the solutions we offer and the values of integrity, expertise, passion, and innovation. Be sure to follow Global Partnership for Telehealth on Twitter, Facebook, and LinkedIn to stay up to date on our webinar series, as well as other important information as we continue to leverage telehealth across the globe. At this time, I'd like to introduce our speaker and presenter today, Boyd Mark. Boyd Mark is dedicated to transforming healthcare by leveraging technology and innovation. He is a senior advisor to Global Partnership for Telehealth and founder of Pediatric Telemedicine of America, a national multi-specialty provider of mental and behavioral health services for children. He founded the Autism Telehealth Program at the nonprofit The Scott Center for Autism Treatment on the campus of the Florida Institute of Technology, a Tier 1 STEM university. The program is a national model for improving access and outcomes for families dealing with autism. Boyd is a Silicon Valley veteran with experience at Microsoft, Intuit, and Apple. He holds a BA in history from the University of Texas at Austin and an MBA from the Thunderbird School of Global Management. Boyd resides with his family in Indialantic, Florida. Please welcome our speaker and presenter, Boyd Mark.
Hello, I'm Boyd Mark, Program Manager for the Global Partnership for Telehealth and Southeast Telehealth Resource Center Toddler Tracks program. Thank you very much for joining us today. I'm excited to tell you about this program that is launching on April 2nd, which is World Autism Awareness Day. Toddler Tracks is a pathway to tackling autism, and it is made possible by CARES Act grant funding. There's a tremendous need to reach families out there who are not receiving services, and that is what Toddler Tracks is focused on. Autism has reached epidemic proportions. In 2018, the CDC raised estimates by 15% to 1 in 54 children. That's almost 2% of the population. Boys are at 1 in 37, girls are at 1 in 51. With intervention between the ages of 18 months and 5 years, many kids can make so much progress that they no longer show the symptoms of autism when they are older. And at any given time, there are approximately 370,000 children in this critical early intervention window. However, if you don't reach these kids during this window, their symptoms will last the rest of their life. And according to the American Academy of Pediatrics, more accurate and culturally sensitive screening and diagnostic approaches are needed. The problem is that 50% or more of these children, young children with ASD, do not receive treatment due to a lack of access to services, and less than 50% are screened for autism prior to 48 months. These gaps are even greater in rural areas and among rural populations of color. 75% or more of children with ASD have complex medical conditions that require coordinated care plans. The availability of trained providers meets less than 50% of the demand for services. There simply are not enough behavioral providers. There are not enough developmental psychiatrists out there to deal with these children who need services. But it doesn't have to be the case that these children don't get any intervention and they miss this critical intervention window. The American Academy of Pediatrics has found that parents and caregivers who were trained via telehealth in early intervention methods can successfully reduce the symptoms of autism based on using evidence-based methods. Now, this is critical because if these children receive early intervention between the ages of 18 months and 4 to 5 years, in many cases, their brains can almost be rewired due to neuroplasticity. And literature shows that up to 50% of these children, by the time they reach school age, will have reduced many of their symptoms to almost indistinguishable between their peers. On the other hand, without intervention, less than 2% of these kids will be indistinguishable from their peers. If they don't receive this treatment, it is very unlikely that these children will ever overcome their challenges. And so for the rest of their life, it's going to be about managing these symptoms that go along with autism, challenges to communication, challenges to socialization, and challenges with behavior. That has enormous implications for the potential of these children. It has enormous implications for families, the healthcare system, the school system. The Toddler Tracks program is focused on getting parent-mediated resources to these parents who are awaiting services. Toddler Tracks is not a replacement for professional services, but it gives parents tools to use to take steps that can lead to meaningful progress in their children while they're awaiting access to services. And telehealth is really an ideal way to do it, which is why the Global Partnership for Telehealth and the Southeast Telehealth Resource Center have undertaken this program. Telehealth is efficient and effective for delivering these services to families dealing with autism. Telemedicine-based treatments can have equivalent outcomes as clinic-based and in-home services for children with autism, according to the American Academy of Pediatrics. Telemedicine can provide equivalent outcomes at significantly reduced costs, according to a number of different university studies. And that makes sense because people aren't traveling, parents aren't traveling, they're not taking time off from work. And that achieves what many of you may be familiar with, which are the triple aim goals, which is improved patient satisfaction, population health, and reduced per capita cost. Plus, in the time of COVID, it's reduced provider burnout and enhanced safety. So the Toddler Tracks program is a telehealth solution to reach children in this critical early intervention window who do not otherwise have access to services. Let's hear a short video about the Toddler Tracks program that's launching on April 2nd.
Once upon a time, not so long ago, when children showed red flags for autism, their parents were told, "Wait and see." Now we know that's just plain wrong. Early intervention can dramatically reduce the severity of autism and in some cases even eliminate symptoms entirely. It is critical that parents urgently begin evidence-based intervention. They can't wait and see. But knowing what to do can be overwhelming. Who do they turn to for help? The Global Partnership for Telehealth, with CARES Act funding, is launching a suite of telehealth services, including parent training, resources for healthcare professionals, and online treatment services. Visit us at gpth.org/autism to learn more and join the effort to make access to autism care for everyone the new normal in 2021.
I hope you're as excited about the Toddler Tracks program as I am. I'd like to give you some examples of the type of children who would benefit from the Toddler Tracks program. The first is a child who's been screened as at risk, but does not have a diagnosis. And just to be clear, things like the MCHAT, the Modified Checklist for Autism in Toddlers, identifies risk via screening, but a screener is not a diagnosis, and not all kids who are screened positive will be diagnosed as positive. but many will. So you have a little girl like Sophia. She's 2.5 months old, and she's been screened as at risk for autism. She's not meeting her key developmental milestones in communication and cognitive abilities. She's taken the modified checklist for autism in toddlers and has been screened as at being at high risk for autism. But she's on a 6-month wait list for an autism diagnosis. And imagine what this is like for a parent who's being told, don't wait, don't wait. There's nothing more critical than acting immediately. And yet they're told, you have to wait. Well, that's no longer the case. Mom can complete the online Global Partnership for Telehealth Toddler Tracks training and begin applied behavior analysis-based parent-mediated intervention. Toddler Tracks will focus on the basics: food selectivity, positive reinforcement, communication, and problem behavior. With these skills, mom can begin to see reductions in difficult behavior using picture communication systems and positive reinforcements. So when Sophia arrives at that point, when she gets a diagnosis and then goes in for services, they're already on the right track, and those valuable 6 months have not been lost. Here's another example of who the Toddler Tracks program is designed for. Carson. Carson is 18 months. He's not meeting his key milestones, including social, emotional, and cognitive domains. Carson has been fortunate enough to receive a diagnosis so that his family knows what the problem is and they know what kind of treatment he receives. However, Carson is in an area where there are no ABA providers. It could be 6 months, it could be a year before Carson ever gets access to services, even though his condition has been diagnosed and we know what he needs. And his health insurance, whether it be private insurance or Medicaid, would pay for the services. Now, how frustrating is that, and how tragic is that Carson is in a position where if he receives services, he could see great reductions in his symptoms, but he simply can't achieve that because there's no access to services. So Carson's parents take the Global Partnership for Telehealth Toddler Tracks training program, which is about 90 minutes, and they begin ABA-based parent-mediated intervention while he's awaiting services. And let's not forget, there are tremendous family impacts. The parents of children with autism experience increased stress and mental and physical health problems. Many of you are probably familiar with the Caregiver Strain Index, the CSI Index. CSI Index scores for families of kids with disabilities are really off the charts. These parents have a lot of challenges. Mothers earn an average of 56% less than mothers of children with no health limitation. Nearly 60% of parents of a child with autism took a leave of absence from work during the past year. One of the main reasons that kids often can't get treatment is because parents have to travel long distances, and that's a huge barrier, especially in rural areas. Siblings cope with feelings of embarrassment and difficulty interacting with their brother or sister. They don't understand why they can't go out in public with their sibling the way their friends and relatives do. They don't understand why their older brother or younger sister behaves in a way that's totally different from all the other kids. And we know that mental health counseling improves caregiver coping and stress management skills, sibling health, and the generalization of therapy. So the Toddler Tracks program is going to provide resources for parents and families, and also for medical professionals that will help to address these problems, in particular for families while they're waiting for services, and for medical professionals like nurses, physician's assistants, primary care providers, to recognize the signs of autism. So here's a short sample of the parent program. And I want to emphasize that all of these resources, thanks to CARES Act funding and the Southeast Telehealth Resource Center and the Global Partnership for Telehealth, are completely free. When this program launches on April 2nd, these resources will be available to everyone at absolutely no cost.
Hello, and welcome to the Toddler Tracks program, the pathway to tackling autism. My name is Patrice, and I will be here to take you through this program. This online education and training program on early childhood autism intervention is made possible by the nonprofit Southeast Telehealth Resource Center and the nonprofit Charitable Global Partnership for Telehealth through CARES Act funding. We've designed this program for the parents and caregivers of infants and toddlers. That includes children between the ages of 12 months and 4 years. However, even if your child is older and is late in reaching their developmental milestones, these videos can be very helpful. You'll learn how to identify and track the important progress points or milestones in your child's growth and development, how to identify concerns, information about autism and its symptoms, what to do if you have concerns, and how to find help, including online or telehealth services. You will also learn some overall healthy parenting practices that will make your efforts at parenting less stressful and more successful. The Toddler Tracks program is divided into 3 sections. Each section has several short videos that can be watched in order, or you can skip around and choose which video you want to view. Keep in mind, however, that you will learn things in earlier videos that will come up in the later videos. Anytime, you can go back and rewatch some videos to be sure you are following along. The first section is focused on developmental milestones. This section looks at how children develop progressively more advanced abilities or skills as they grow through their infant and toddler years. From listening and pointing to learning new words and constructing complete sentences, your child has many opportunities to learn. Our goal is to increase your child's ability to learn through practice as they grow and build these new skills. Acting early can make a lifetime of difference for your child. Thank you for joining us, and let's get started.
So you've just seen an introduction to what the Toddler Tracks program will be. The Toddler Tracks program for parents will be 90 minutes, and the program will include multiple videos, all organized sequentially, but parents will be able to go through and look at different things at different times. The training program is, again, absolutely free, and it's for parents whose children have been identified as at risk for autism. It will include exercises and information for working with their children to ameliorate the symptoms of autism. All of the materials will be based on empirically verified, evidence-based strategies. The key components of this free 90-minute online program will include the importance of developmental milestones, because missing those milestones is a key indicator that a child has a developmental disability, and in particular, often autism. It will include information on how parents can monitor and conduct surveillance of milestone progress, especially if there are concerns. It will include healthy parenting skills. It will be based on the ABCs of behavior, which refers to behavioral psychology and the antecedent, behavior, and consequence. The ABCs of behavior are the basis for applied behavior analysis therapy, which is the gold standard for early autism intervention, and really the basis even for healthy parenting skills. And a key part of the program will provide enrichment exercises and daily living skills training. So when the parents begin to see risks and red flags in their children, they're going to be around things like not understanding verbal instructions, not being able to communicate effectively, problem behavior. So the 4 key behavioral skills that parents will be trained in the Toddler Tracks program is around communication, feeding and food selectivity, because often kids who are on the spectrum or at risk for being on the spectrum have highly selected diets, and those that presents nutritional issues for these children. Parents will also be trained in how to deal with problem behavior. Often children act out because they're very frustrated. They don't understand what's going on around them, or they do understand, but because they lack communication skills, they can't communicate their needs. And so that often leads to tantrums and difficult behavior. And finally, the key is positive reinforcement. Positive reinforcement is a crucial component of applied behavior analysis, and so the parents will learn those 4 key skills. There will be parent interviews and stories from parents talking about their own experiences, their own delays in getting diagnosis and treatment for their children. Parents of kids with autism and related disabilities often feel very isolated and alone. These parent interviews will show them that there is hope for the future and they are not alone. There will be tools and resources. There will be downloads and checklists, guides to help these parents implement these things on a daily basis. And we're also being very realistic. These are not things that parents will do and see results overnight. These results and the outcomes of the enrichment exercises and daily living skills will take time. We've partnered with very well-known autism experts and therapy providers to develop this material. The second part of the free Toddler Tracks program, which launches on April 2nd, is the medical professional program. This program is for medical professionals who are seeing these kids come into their clinics. And often these medical professionals really just don't know how to identify what's going on with this child. Is this child, for example, showing signs of autism as related to speech delays, or are they more typical physiological delays that might be related to something that is more appropriate for a speech language pathologist? Is this child showing behavioral issues due to ACEs and trauma factors, or is it autism? Or is it a combination of those things, which is often the case? The American Academy of Pediatrics has made it very clear in their recommendations that there needs to be better training for providers in doing differential diagnosis and recognizing the signs of autism, and also more culturally sensitive approaches to understanding differences in behavior. Here's a short sample of the provider material.
My name is Dr. Michael Kelly. I'm a licensed psychologist and a board-certified behavior analyst at the doctoral level. I specialize in diagnosis and treatment of autism in young children. I'm an educator, a trainer, a clinician, and a researcher, and I'm pleased to be here to talk to you about this program. We are so excited to be a part of bringing this free medical education program on early autism intervention to you. This program has been made possible through the CARES Act funding and the Global Partnership for Telehealth. We've consulted with experienced pediatric autism specialists to develop this program for medical professionals, all to assist you with early, timely assessment and intervention among infants and toddlers. You'll hear from Dr. Kaylin Lane, a board-certified child, adolescent, adult, and forensic psychiatrist. Dr. Lane will address ASD-related clinical challenges like identifying different presentations of ASD, solutions to co-occurring medical presentations and treatments, and the coordination of all these multidisciplinary care specialists that are a part of the team. Dr. Lane has been successful in utilizing telemedicine to minimize geographic access barriers to care. In her second segment in this program, she will discuss options for overcoming these clinical challenges to autism treatment using technology. We're also very pleased to have a presentation from Rady Children's Hospital in San Diego. You'll learn all about Rady's award-winning Kid Start program, a very successful approach to care coordination and behavioral health integration for young children on the autism spectrum. The Kid Start approach brings together multidisciplinary specialists to create a custom treatment plan for children with multiple needs. Intensive family support services are also provided, which of course will help families understand the unique needs of each child, as well as to access immediately all these needed services, and then of course to plan for future services that might be needed as the child grows older and matures. Behavioral health integration models are so well suited for a telemedicine-based approach because you can deliberately organize custom care activities and information sharing among the entire care team. The caregiver training modules will include exercises and information for working with children to address symptoms of autism. And this is especially important while these parents and children are waiting for access to services. Once upon a time, not so long ago, when children showed red flags for autism, parents were often told, just wait and see. Of course, now we know better. Whether these developmental delays are caused by autism or some other factor, children who are diagnosed with developmental disabilities are unlikely to simply just grow out of their problems. We know that waiting is the absolute worst thing we can do. We risk losing valuable time at an age when children have the best chance of improvement. We hope you find this information valuable. And remember, don't just wait and see. Please act early. Thank you.
That gives you an idea of the medical professional portion of the Toddler Tracks program. It's a 90-minute program for healthcare and medical services providers. It's composed of different videos and different components. It's an online awareness and training program that will provide information and resources to assist these providers with early assessment and intervention for infants and toddlers presenting the symptoms of autism. Again, this is absolutely free, and CTREC and GPT are working on getting accredited medical education credits for these programs so that medical providers can do this as part of their continuing education. The key components of this free program for providers will be assessment and diagnostic education for working with children who are presenting the symptoms of autism, telehealth diagnostic and treatment options, behavioral health integration information. This is really critical for these children who have complex medical conditions and co-occurring conditions, which is something like 75% of the children. There will be information on how to advise and counsel parents. Very challenging when these medical professionals have to meet with parents and tell them, I think your child is at risk and you need a diagnosis, but unfortunately there's a 6-month, 9-month, 12-month wait list to get a diagnosis. Again, imagine being in the parent's position when you're being told you absolutely should not wait a day, and yet you're being told you have to wait 9 months or a year. Those are difficult conversations for the healthcare providers, and we want to give them resources and advice on how to handle that. One of the things that these healthcare providers can do is to refer parents to the parent training program. There will also be parent interviews, so healthcare providers get a sense of what it's like for these parents to be going through this. In both the 3-hour parent program and the 90-minute provider program, there will be a focus on, for free in the Toddler Tracks program, referring these families and providers to the Global Partnership for Telehealth and to the Southeast Telehealth Resource Center to get more information about actual diagnostic and treatment services that are increasingly available online, especially, as we all know, as a result of COVID, there has been a real move and a greater acceptance of telehealth, and GPT and CTREC are building out their autism treatment services that are available on their network. Some of those telehealth services for autism spectrum disorder that GPT and CTREC are building out that these parents will be able to access include screening services for autism, behavioral assessments, and that is a diagnosis. And the literature shows that up to 80% of kids are suitable for an online diagnosis. The literature shows that approximately 20% are difficult to diagnose online and need to be diagnosed in person. However, the accuracy of online diagnosis is very, very high, and it's a great option for families. Parent-mediated intervention. That's another term for parent and caregiver training. The free 3-hour caregiver training in the Toddler Tracks program is based on a structured, peer-reviewed, effective parent caregiver mediated intervention program. There are more structured programs that are usually covered by insurance. GPT and C-TREC will be providing those resources. Direct treatment and supervision of treatment is available online. Family treatment and coaching, which is so important for caregivers being able to care for themselves and for siblings to be able to cope with the situation, will be available. And further psychological counseling and also medication management. These are services that can be provided via telehealth. The free Toddler Tracks program includes the 3-hour parent program with an introduction to caregiver mediated intervention so that parents can take action, an introduction for providers to become more skilled and build their abilities at doing differential diagnosis and providing them with resources to refer parents to. Ultimately, though, we need to be very, very clear that these children need professional intervention. And increasingly, those services are available online, and GPT and C-TREC will be providing them. I'm really excited to be part of the Toddler Tracks program. And I want to reiterate that it will be launching next week on April 2nd, if you're watching this live. And if you're watching it later, the program may have already launched. The Toddler Tracks program will only be useful if people use it. And so there is an outreach program that will be in place. The launch is April 2nd, which corresponds to World Autism Awareness Day and Autism Awareness Month. That is really just the beginning, though. We're going to be engaging in outreach to ensure that over time, these resources are used. We're going to actively be engaging with rural health clinics, federally qualified health centers, local governments, primary care providers, and community stakeholders. We will outreach to preschools and kindergartens where teachers see these kids all the time. And often a parent might not know that their toddler in preschool isn't reaching their milestones, but teachers and preschool workers often identify it. So they're an important group to be able to get to so that they can refer families to services. We're going to be working and partnering with healthcare training organizations and universities who have their professionals out in the community so that we can directly communicate with these professionals and let them know about the free Toddler Tracks resources. There is a Toddler Tracks website where the videos and the program will be hosted. There will be downloads for parents to use. They can sign up for newsletters. We will be providing printed materials for clinics and pediatricians and PCP offices. We will have active social media targeting parents, and we will be working with the press and influencers in the healthcare community to spread the word about this program. And certainly last but not least, we have the Toddler Tracks Ambassador Program. And I would like to invite everyone who's watching this to participate in the Ambassador Program. I would like to invite everyone who is watching this to become a Toddler Tracks Ambassador. If you are a healthcare worker, a community worker, an activist, a telehealth professional, then you're in contact with people who need to know about the Toddler Tracks program. Toddler Tracks ambassadors support the Toddler Tracks program by reaching out to organizations and professionals in their community. And these are people that you may be working with on a daily basis in any case. We can provide you with resources and information to do that effectively and easily and successfully. Toddler Tracks ambassadors direct families and professionals in their community to Toddler Tracks resources. And we really need your help in doing this. It's as like to make. Toddler Tracks will be successful, when the community and Toddler Tracks ambassadors get engaged and help us spread the word. And critically, we would ask Toddler Tracks ambassadors, when available, to periodically participate in education and brainstorming sessions, where over time, as we learn what's working with the Toddler Tracks program and what's perhaps not working as well, that we get feedback from people out in the community, from educators, from healthcare professionals about ways that we can make this program more effective. And we'd like to let our ambassadors know about new resources, new additions to the Toddler Tracks program that can be of value to the families in their community. So please, in a few minutes, make a note of the Toddler Tracks website and come and sign up for the Toddler Tracks Ambassador Program, or at least sign up for the Toddler Tracks news alerts so that you can stay apprised of what we're doing. And I would like to close that with a message from one of our key leaders who has made this program possible.
This free program is made possible through CARES Act funding to the Southeastern Telehealth Resource Center and the nonprofit Global Partnership for Telehealth. This program is designed to provide needed training and increase awareness of using telehealth as a means to reach hard-to-find specialty care. My name is Rena Brewer, and I lead the nonprofit Global Partnership for Telehealth. I'm also a registered nurse, a mother, and a grandmother. In the past, it has been very common that when parents reported to their doctors that their child was showing red flags for autism or were behind in their development, they were told to wait and see if these issues will go away or improve. But now we know better. Waiting is the worst thing you can do. You risk losing valuable time at an age when your child has the best chance for improvement. And whether the delay is caused by autism or some other factor, kids are unlikely to simply grow out of their problems. The symptoms of autism can often be seen between 12 and 18 months. If action is taken between 18 and 48 months, intensive treatment may help to rewire the brain and reverse the symptoms. Research proves that acting early can have major positive effects that last a lifetime. You must act early. It can make a lifetime of difference, but it can be overwhelming. How do you know if your child is at risk? Where do you turn for help? If you suspect delays or autism, it is critical that you contact your child's doctor or nurse immediately. These services can be covered by most health insurances and Medicaid plans. While you are waiting for an evaluation or therapy services, you can still act early. This program will help you. It'll help your child get started on the right path.
Thank you for joining us today. I'm so excited. Please visit the toddlertracks.org website right now. Log on while we're wrapping up this presentation. And sign up to get more information, sign up to become a Toddler Tracks ambassador. And if you have any questions, would like any more information, please do not hesitate to contact me. You can reach me at boydhmark@gmail.com, or feel free to call me. That's my number right there, 425-214-6388. And if I don't answer right away, I will get back to you. Remember, we can change the game for these children who have an opportunity to change their trajectory with early intervention, but so many of them don't have access to services. We are giving parents and providers free resources to help these children change their trajectory while they're waiting access to services. So be a part of Toddler Tracks and be a part of changing the game for children. Thank you.
Thank you, Boyd, for that presentation and all of that great information. I do have a few questions.
Okay.
So the first question, Boyd, is, will this program be available in other languages?
That's a great question, Sherry. And at this time, it's only available in English. However, we hope to extend it, and there's two aspects to that. One is the ability to produce it, which we can do, and the other is to have the healthcare professionals who speak that other language and also are familiar with the vocabulary and terminology. And if there are folks out there who work in the field, who speak Spanish or Creole or some other language, please reach out to me. Maybe we could figure out how to move something forward in another language. The initial launch, however, will be in English.
Okay. So the next question is, how do we make screening mandatory?
Well, that's a bigger question than I can answer. I am happy to say that screening rates are improving. It just very quickly in 2014, I believe, the American Academy of Pediatrics reported that screening rates were around 20%. 2016, they were a little less than 50%. And these are for kids being screened before the age of 48 months. And the AAP's guidance is very clear. It's 100% all kids by 30 months. And now I think those rates by 48 months are actually pushing up into the 60% range. So screening is becoming more widespread. There's a generational mindset with pediatricians, but the numbers are still far too low. And we just have to keep working with the medical community and advocating for it. And what has happened is that, somewhat ironically, now that more kids are being screened and identified, more than ever, there's a shortage of access to services. So we're really, in particular with the Toddler Tracks program, looking at what do these parents do who know that they need resources, but they're on wait lists. As more kids are identified, there's a bigger demand for services, but there really is not an increase in service capacity. So that's where we're focused with Toddler Tracks.
Okay. So the next, I have a couple of questions. I'm going to kind of put it into one question. So I do have someone wondering about virtual diagnoses. So will telehealth treatment services be available, or excuse me, will services be available through telehealth? Will you be able to do virtual diagnoses? And if so, or is this located somewhere on your website, the information about this?
Multi-part question there. The Toddler Tracks program in our initial launch next week isn't providing telehealth treatment and diagnostic services per se. The website will direct people to the Global Partnership for Telehealth, which is building out its network of providers who can provide those services remotely. Doing diagnostics via telehealth has been demonstrated through peer-reviewed published research to be highly effective. And we would be happy if we created a challenge to having so many people coming and asking for services that we really have to accelerate that process, because that would mean that people are accessing these resources, and that would mean that these parents are recognizing that they have options besides just waiting. The initial Toddler Tracks program that's part of the GPT C-TREC CARES Act grant is focused on the training of parents and the education of healthcare professionals. We are going to have an area of the website, toddlertracks.org. Please visit that website, which will be complete. It's up now, but it will be fully complete by next Friday, if not before. There will be an area on that website for people to get information about telehealth services.
Okay. And then another question is around getting involved. So such as, like, how can they get involved in areas such as promoting Toddler Tracks in their communities?
I love that question. Thank you so much. Well, if you go to the toddlertracks.org website, right there on the homepage, there is a place to submit. Just say, hey, sign me up by email, and I will follow up with you. You can email me at boydhmark@gmail.com, and we're going to operate this so that if someone has just a little bit of time to get involved in their community, we'll have tools and resources to help them do that through social media, through things they can hand out, through things that they can take to parent groups. If they have more time and they'd like to get really involved, we're going to have ways for people to do that. And that is so important, because this program will only be successful if parents and caregivers of these families and these medical professionals access the resources, and the best way to do that is to work with people directly in the community. So please get in touch, and we'll be thrilled to talk to you about that.
And so if there's someone interested in becoming an ambassador, what would be some of the responsibilities they'd be tasked with, and how do they get involved that way?
Great question. Well, the ambassadors in particular will be involved in some periodic online Zoom style meetings where we'll brainstorm ideas on how to better reach people in the community generally, and in particular, if those folks who are ambassadors have specific ideas about things that they'd like to do in their community, we'll brainstorm those things and come up with ideas on how to make that possible. Time spent with the ambassadors would also include then maybe another level of detail about talking about what can we do to support you with resources, whether it's handouts and downloads. Maybe it's doing webinars specifically for people in particular communities. Ambassadors can get involved in really just figuring out what can be done to have a greater impact in their community. And that is for groups that are serving families. And also, please, by all means, if people are healthcare professionals and they also want to organize things in their professional community to get this free healthcare training information to people, we'd be thrilled to work on that too.
Okay. One more question I believe we have comes from Jacqueline. It seems to me that most providers want to diagnose autism when the child reaches 3 years old. Is this changing?
That's a great question. And, full transparency, I am not a clinician. I work with a lot of clinicians, and my understanding is that increasingly the perspective is that a reliable diagnosis can be made by the age of 18 months. That is the perspective among the clinicians who are leaders in this field. One of the things that we want to accomplish with Toddler Tracks is to close that gap with the providers who are out there working with kids every day, dealing with all kinds of different conditions. And they may not be fully up to speed on what the AAP has referred to as this need for better diagnostic approaches and better approaches to differential diagnosis. So my impression, my understanding is that that's exactly right. You'll find a lot of primary care providers and nurses in clinics, especially in underserved areas, who are going to wait till maybe 3 or 4 years old because that's what they're comfortable with. And what we would really hope to achieve with our healthcare training is to give these providers the tools to recognize and refer and to diagnose at an earlier age, because it is, according to all the literature, absolutely possible to reliably identify these kids who are at risk and to do a diagnosis as early as 18 months. And that year between 18 and 30 months or up to 36 months is a huge window of opportunity. That missed time is brain time. And so we really want to do everything we can to work with providers to push that age of recognition down to a younger age.
Okay, and I've had another question in the chat box, and I'm operating two chat boxes. There's a Q&A box and a chat box, and I've also got stuff coming into my email, Boyd, already, several messages about your presentation. But I'll go ahead and ask this question. She says, I would like to be considered for being an ambassador. Also, does your 3-hour training provide a certificate?
Yeah, great. That's a great question. The parent training does not include any kind of certificate, although we could come up with something. There's no real organization per se that recognizes parent training, but we could certainly come up with something that is an acknowledgement to parents that they have gone through this program. I like that idea. On the healthcare professional side, we are working on getting CEU credits and also working with one of our partners, one of our health education partners, to get medical education credits for doctors, so that there is an incentive for them to go through the professional training as part of their continuing education. I mean, that's a great idea. You know, that's a great ambassador idea right there. I love it. What can we do to have some kind of certification and recognition for parents? Yeah, let's talk more about that.
Yeah, that is a great conversation to be had. So one other comment that has been made is they're not able to pull up the website. So you've got some folks that are trying to get to that website. Could you go into more detail about the website?
Yeah, that website, you shouldn't have any trouble. toddlertracks.org.
Maybe you could post it in the chat.
Yeah, great. Let me do that. I'm going to take it right out of my browser right here.
Okay, and then someone else, a couple of other people have said they have been able to access the website with no trouble, but not able to find the information on ambassador on there. And so maybe if y'all are having any trouble reaching a certain link that you're looking for, just reach out to Boyd, maybe in a email or call him, and he can help you gather that information that you're looking for.
Yeah, absolutely. Reach out. And Sherry, just to clarify, we are officially launching next Friday, and the homepage of the website is live. The ambassador page, though, is not live yet. We've got quite a bit of work to do over the next few days. So that's why you're not finding that ambassador information. However, as Sherry said, reach out to me and we'll get those conversations going immediately. And what you'll also see when the program launches a week from tomorrow is that there will be the pages with the parent training program. So you'll be able to go through and you'll be able to see all of the videos, and they'll be organized and so forth. So it's the homepage today. We've got a little bit of work left to do, but please reach out to me, and I would love to hear from anyone and everyone who would like to get involved, and thank you in advance for that.
Okay, and Boyd, if you don't mind, would you post your email address in the chat as well? That I have some that are asking for your email address. There have been several to message me already asking for your PowerPoint presentation. I will be, as you email me, I will send you Boyd's PowerPoint presentation. If you email Boyd, I'm sure he will be happy to send that presentation to you as well.
Thank you, everyone.
Yeah, and Fran says, thanks, Boyd, and that this is an amazing initiative and good luck. So I believe that everyone has enjoyed your presentation and is grateful for the information that you have provided. Thank you so much, Boyd, for taking the time to do this webinar with us and have this resource available. to others. So we do
Well-
appreciate it. If you have any questions, any follow-up questions, please reach out to me. It is jennifer.murphy@gpth.org. And Boyd has his information posted in the chat as well, if you would like to reach out to him. All
Thank
right.
you,
Thank you, everybody. Y'all have a great day. And Boyd, did you have any closing remarks?
I did. I just wanted to thank you, Jennifer and Petey, for making this possible today. And really big shout out to the leadership at the Global Partnership for Telehealth, Sherry Williams and Rena Brewer and Lloyd at C-TREC. It's really that team that has made this possible. So thanks to them. And with that, I look forward to hearing from everyone. And we're just getting this going, and it takes a team. And teamwork makes the dream work. So let's go have an impact. Thank you.